My name's Glenn Nye, and I run the Center for the Study of the Presidency and Congress, which is a think tank located in Washington, where we look at the relationship between the executive branch and the legislative branch and try to understand ways that we can influence politics to be a little bit more responsive to citizen interest and less gridlocked and dysfunctional. And you and I know each other through a course that I teach twice a year on presidential leadership in history, where we looked at a number of factors of historical presidential leadership and current challenges, including the COVID-19 pandemic for this year. I was a member of Congress representing the 2nd District of Virginia, which is coastal Virginia, everything from the border of North Carolina up to the border with Maryland that touches the Atlantic Ocean. And I represented a heavily military veteran, military family community of Hampton Roads in the Eastern Shore. Had a chance to spend one term in the House of Representatives and served on the Armed Services Committee, the Veterans Committee, and the Small Business Committee.
Would you mind just stating really quickly the year of your term?
Yes, I was in office, elected in 2008 and served in office January 2009 to January 2011. And in fact, we had a pandemic crisis when I was in office then too. That was the H1N1 flu. It wasn't nearly as bad as the COVID-19 crisis, but it did give me kind of an introduction to some of the things that public policymakers need to think about when it comes to managing pandemics. And in fact, one of the memories I have from that time was we were asked, every member of Congress was asked to film a public service announcement that could be used in their district that encouraged people to change behaviors. And one of them was just reminding people to cough into your arm versus your hand. Just as a public health measure. I mean, it's kind of basic common sense things like that, that are practices that most people just had either kind of forgotten or just weren't used to practicing. And I think that compares in some ways to the idea of having people wear masks now. One of the key differences, I mean, obviously COVID-19 is more extreme. And so the mask was something that was more necessary. Back 10 years ago, coughing in the sleeve, it was just a smaller pandemic and a less virulent strain of the flu. And so that was the measure that was needed at the time. But we did learn a little bit, I think, this year in terms of human nature in responding to those kinds of suggestions. Of course, in 2020, they became more than suggestions. In a lot of places, they became mandates. People were required to wear masks, whether by the local or state government or by the businesses that they wanted to go to, like grocery stores and other shops. And I also had the opportunity prior to serving in Congress. I spent 10 years in the Foreign Service. 2 of those years, or just under 2 of those years, I was in Singapore, and I was there during the SARS pandemic. So I got to observe how Asian countries, specifically Singapore, but we also were observing China at the time, how they responded to public health crises. And one of the things that I learned from that time was in Singapore, it's a smaller country, obviously, it's a city state. But I think they were much more used to culturally the idea of doing things like of changing behaviors. And in the United States, it was very uncommon to wear a mask when you have a cold or if you have the flu. Whereas in a lot of Asian countries, it was very common for people. They were already used to that idea. If you don't feel well, if you're not sure, you wear the mask to protect the people around you. That way, if you need to go to the grocery store, you're not as concerned about spreading a virus to other people.
Yeah, that was actually going to be one of my questions, so answered it pretty well. Yeah, that's definitely a good experience to have, especially because SARS-CoV, and COVID-19 is SARS-CoV too. So
right. So they're connected in many ways. Although this year's 2020 was much much worse, more deadly and more virulent. But I think we learned, trying to create mandates, even for public health, and even when they are ostensibly very reasonable, have human implications. You can think about, I think, 2020 and COVID as a stress test on several elements of America, and one of those is just the human side of it. It's a sensible ask and a relatively low cost, both money wise and behavior wise, to wear a mask, and yet it is unusual enough to have created, I think, unfortunately, more friction than I had expected. It's, I guess, human nature, and particularly in individualistic America, even more so, not to like to be told to do things. And so I get that there were people that responded very poorly to the idea of being told they had to wear a mask. Even though, number one, it's actually in your own best interest to protect yourself, but also it's a community question, right? You're being asked to wear a mask. Some people will say, well, I don't mind. I'll take the risk. I'm not afraid. I don't think I'm going to get this. I'm not worried about getting sick. But the other element of it, of course, is that you don't know if you're carrying it. So you wear the mask to keep everybody else around you safe. And to some extent, any public health recommendation to be implemented effectively inevitably has to be implemented more than is probably actually necessary, because there's always an unknown, right? You can't tell necessarily who carries a virus. You don't always know what the right measures are, how many times and how long you need to wash your hands. Well, you might say 20 seconds is too long. Somebody else might say 10 seconds is enough. Somebody else might say it's more. But if you're in the business of public health, you have to recommend things that you think catch the majority of the problem, or almost all of it. And sometimes you got to recommend more than is maybe absolutely necessary. So I think that's the way I look at it, is you take a recommendation, and if the public health professionals tell you that you should wear a mask, I didn't have any problem with that, but clearly there are those who did. And I think you could look at the US, and if you wanted to just do an evaluation of how well we handle things like that, say that this was a pretty effective stress test on our ability as a community to see this as a joint problem and to do the things that we all need to do to make sure that everybody else around us are safe. I think by and large we did that, but there were clearly examples where that didn't work. And there were clearly examples of public leaders who very much pushed the scientific recommendation, and those who did not. And I think that also created some challenge, because when you see, it's easy for people in a political environment to take the recommendation of the politician that makes the easiest recommendation, the most convenient recommendation. And that's true not just during pandemics, but anytime. It's very common for politicians to tell you that their plans cost you nothing and bring you lots of value. And the ones that are more honest with you about the cost tend to sometimes not be as successful politically. And so that's a dynamic that I think we had to observe this year.
Yeah. One of the interviews I did was with a friend of mine who is from Britain, and she lives in London. And we were talking, because this was towards the end of prior to yesterday, their most recent lockdowns. And she was like, yeah, I mean, there are definitely people who didn't want to wear it, but who didn't revolt against it. And I was like, yep.
Well, in some ways, it's like people didn't revolt so much, I think, against the wearing of the mask as the symbol of being told to do something that they either didn't want to do or didn't think was necessary. And this is also a problem of politics, because what you'd like to have seen is Americans of all political stripes come together and give a joint message. And even if the message isn't convenient or perfect, right, you would have liked to see leaders on both parties say to each other, hey, this is an important thing. Let's not politicize this. Let's do the opposite of that. Let's figure out a way to come together and say, right or wrong, this is our best recommendation. We consulted with doctors about it. This is what we feel we need to do. We know you're not going to like it necessarily, but let's do this together. And I think if you had politicians stand up together, I would have loved to see not just a presidential daily briefing on this, but why not a bipartisan daily briefing where leaders of both parties said, this is a serious thing. We're strong as Americans. We're going to get through this, but there's some things we need to do. And so we're here to tell you that we're putting aside politics, and we ask you to do the same. And now we're going to turn the briefing over to the scientists who are going to make their recommendations, and we're going to stand by them. Even if we don't necessarily agree with all of them or like them, we're going to give them the credence that they deserve as experts, and we're going to be unified because we know at the end of the day, we're better off if we stick together. Mm-hmm. And then look, as we go, if we learn new things and we need to adjust, we will, but we'll discuss it and we'll come out as a unified team and tell you we're not necessarily agreeing to put aside all of our political differences on every issue, but on this one thing, we're not going to let politics destroy the outcome. We're going to work together to the best end we can. Mm-hmm. I think if they had done that, you would have seen a more calm response around the country. I think more people would have said, okay, the leaders that I like and the ones I don't necessarily like have said the same thing here. So I think that's what I need to do. So regarding you as like a person, when do you first remember hearing about the virus, and, what were your initial thoughts? I mean, I first remembered hearing about it being reported as an outbreak in China. And I started remembering the time that I spent in Singapore and how the government there and the government in China responded to it. And I remember recollecting that the Chinese government did not respond very well in the early days of the SARS epidemic, and it spread quite quickly. I wasn't thinking about it quite in the global terms yet, but I was just focused on, the potential challenge, just recollecting what I learned about SARS. And then as I learned more and more about it, it became very clear, this is, I guess, February or so, that it was going to be a global problem. And again, looking to elected leaders in current positions to try to come together with some joint approach to this, which clearly never happened. And I was disappointed by that. And then I actually ended up focusing on it more specifically for me and my work when early March, we were planning to host some fellows that we usually bring into Washington twice a year. And we were going to bring them in later that month to Washington. And we had to decide, is it still safe based on what we learned about the pandemic to ask them to travel to Washington to convene them. And we were torn on this because we were trying to understand the science and it was changing quickly. And then we noticed that a number of schools started canceling in-person classes for the rest of the semester. And we realized, well, if the schools are doing that, then it wouldn't make sense for us to try to bring these students who are being sent home to convene them together. We better switch to a virtual format. And then we had the challenge that almost everybody else had this year, which was, can you take your work and make it remote, right? Can you do the things that you normally do, but via video versus in person? Fortunately for us, our work translated pretty well. Just like university students, it wasn't as fun. It wasn't as interesting for the fellows who normally convene. I mean, you had this experience as well. Your group would have normally come to Washington for the summer, and you weren't able to do that. So it wasn't as gratifying, but we were able to do it. We didn't have to cancel the programs. So, I mean, it worked out. I think I feel very lucky because there are a lot of people whose work that doesn't translate to online and either required them to take an extraordinary health risk or a lot of people actually ended up losing their jobs. Yeah. What were your thoughts about the U.S. leaving the World Health Organization? Yeah, I mean, based off of your previous experience. I'm not really sure I understood. If you look at it in sort of a risk-reward scenario, I'm not sure that I understood what it brought us beyond sort of expressing in a knee-jerk way dissatisfaction with something. But so, in other words, if one thought that it was useless to be a member of the World Health Organization, then leaving it wouldn't really be a problem. But if it's bringing some value, or you have an opportunity to influence the work of the organization in a way that is useful to you, to your country, then leaving it comes with a large risk. So I think it was the wrong way to look at the risk reward. And I think the better approach would have been to try to change the organization, the way it worked, and make it work better. Look, and I'll admit it's not an easy equation. There are challenges, and any international organization comes with its frustrations, and it comes with shared membership with countries who you might not see having the same goals that you have. And yet you have to ask yourself, is there a pathway for engaging with this organization that makes it more useful, that helps benefit us in the long term? And if there is, I think there's a good argument for staying engaged. If you decide that there's no way, that there's nothing you can do to make it more useful, okay, then leaving makes sense. But I don't think that was the case in this particular scenario.
So had you been a congressman in 2020, what would you have done in terms of COVID-19? Because I know a lot of it is also dependent on the state of the system around you. You know, as an individual congressman, there's only so much you can do.
That's true. I mean, there's only so much an individual can do to pass legislation, but you're an important messenger. And so the first thing that you can do is communicate with your constituents, tell them the facts, and do your best to be honest and very, very open with them. I will say there is a limit to how much credibility politicians have in talking about issues unless they've established some level of trust already. But that doesn't remove the responsibility from the politician to tell the truth, especially when it comes to something like a pandemic where somebody's decision can have very strong implications on their life and the life of the other people that live around them. So just telling people scientific evidence, recommendations like wearing masks and social distancing, just reminding people that it's a serious thing. Some people didn't need reminding, but some did. And you have to take a risk. I mean, that's the hard part is, again, you have to tell people something that they don't necessarily want to hear. Now, I do think we could have improved the way we talked about it. To some extent, I was very troubled by the notion of telling certain people that they couldn't work because their jobs were not essential. I mean, I agree that there are some unfortunate things that had to be done to stop the spread of the virus in terms of like slowing down parts of the economy that involved lots of people gathering. I don't think it's a good idea to tell someone that their work is not essential. Mm-hmm. I think we needed to come up with a better way of explaining why we took the measures that we did to try to slow the spread. Because I don't think anybody sees their business or their job as non-essential. Yes, there are frontline healthcare workers and others who actually are doing the hardest work and putting themselves at risk and have to try to help keep people safe. And there are other jobs that aren't on the front line necessarily, but again, to those people, those are essential jobs, and they fund their families with those jobs and businesses. So I think we could have probably done a better job explaining and communicating than we did, and not been just so blunt. But I think the bigger lesson is just, if I had been in office, I think I would have tried to make an effort to communicate with my colleagues, particularly those on the other side of the aisle, and see if we can come up with some joint way of talking about it, because that's the best way to get people to believe.
Mm-hmm. As you know, this was a pretty huge election year. How do you think COVID-19, just based off of your experience, affected state elections?
Yeah, I mean, clearly it had an impact on the presidential election. I think there were, if you asked, polls did ask people what they were voting on during this election timeframe, and a lot of people, especially in the lead up, but to the election over the summer and like fall, were saying that COVID was an important factor for them. I think it became actually less of a factor as we got closer. I'm not sure I understand completely why. Perhaps people were just kind of getting exhausted with the issue. How it played in state level races, I'm not sure. I think there were other factors that were actually played a much more important role than COVID itself. Mm-hmm. Other economic factors, things that weren't really unique to this year.
Yeah. Also, based on your experience, what do you think were some of the kind of behind the scenes factors that the public not was intentionally hidden from them, but they either just didn't see revolving around Congress and COVID-19?
I mean, I honestly thought one of the most troubling questions that went unanswered was the question around testing, because you get a lot more flexibility in how you handle a pandemic if tests are widely available. In other words, if you're able to understand the spread, if you're able to, at a very micro level, tell people whether or not they're carrying it, it makes the ability to set rules that are less broad and blunt in place possible. Um, Without testing, you basically have to do very painful measures to, to shut things down, to stop the spread. With testing, you can be a lot more specific in the rules, and so, in other words, a lot less stringent. We didn't have ubiquitous testing early on, or even through like the summer, and I never had a good sense of why that was.
Mm-hmm.
I'm sure there were reasons. How much of those reasons were overcomable by better management by politicians, I think should have been more a part of the discussion. So, if I could fix something that had to do with information, I think it would have been that question of testing.
Yeah. At my school, we ran testing events, and we had them every 10 days because that's the average isolation period once you've received a positive test. So it's pretty easy to measure from there. And for so many people, we had to explain, over and over again why they needed to get tested so often. The fact that, just because they got a test doesn't mean that they're just good from the time till they get another test. They could have come into contact with the virus after leaving the testing somehow,
or before, and still not have tested positive yet because they hadn't developed enough viral load to be detectable. It's true. So there's a downside of people assuming that the test solves all their problems, but it does help. And the more you have, the better you can manage a strategy.
In your terms of your current job, do you foresee any sort of permanent changes that will be brought about from this pandemic, even after it's over?
Yes, I do. I mean, I think I would like our team to return back to our office. I would like to have an office to work from. I know that others are considering just going completely remote. I don't think that will be the way we go. I do think we'll probably end up using technology a lot more than we used to. The nature of our work used to be to convene mostly in person. And I don't think we'll stop doing that, but I think we will supplement that with a lot more engagement via video. And the reason for that is what we learned was when you have to make a decision about convening and you're trying to organize around busy people's schedules, it can be really hard to convene events. When some of those participants can participate virtually and they're fine with that, it makes scheduling a lot easier. It means you can have speakers come in from the West Coast to the East Coast or from around the world. We did events this year where we brought speakers from as far away as Singapore for live video events, Japan, all over the US. And I think we will end up using that more than we have in the past. I mean, we've validated the use of video, and fortunately the technology seems to have come along and developed well enough now to really make that useful. So I imagine we'll go back to the way we used to do things for a lot of our work, but we'll supplement it with a lot of technology.
Mm-hmm. My final question is, as someone who has been involved in government for a while and served in Congress, public health experts have pretty much said that it is inevitable that eventually another pandemic will occur. What would be your advice to members of Congress in the event of the next pandemic?
I mean, my advice is hard to heed, but my advice would be early on in the pandemic, make a decision to create a bipartisan group, and it has to be high level, that will assure the American people they're going to put politics aside for the sake of a crisis.
Mm-hmm.
In the same way we would do in terms of a war, again, it's hard to do. Our politics don't promote this. It requires risk and sacrifice on behalf of political leaders. But I think that would be one of the best things they could have done early on, would have been to assure Americans that they're not going to politicize a crisis, and that especially a public health crisis that requires them to ask Americans to make a sacrifice, that they're going to agree to do it in a bipartisan way.
Yeah, I think, in my opinion, something that has definitely contributed to this sort of divide is, I was looking at media coverage of the 2014, well, it was 2013, 2016, but people referred to it as 2014 Ebola epidemic, and how the media covered it and the public response from that. And I've noticed that since then, there's been this growing aggression towards the medical community and science, especially with like vaccinations that has become more mainstream. And I think it's definitely kind of interesting to see in that time since then where political leaders have fallen on those issues and how it may have like impacted now.
Right. I mean, look, one of the lessons here is that political leaders don't like to tell their constituents things that they don't want to hear. And that is just the nature of politics.
Mm-hmm.
But they can minimize the damage to themselves politically if they say a unified message.
Mm-hmm.
Some people on both sides of the aisle aren't going to like it. But the fact that they say it in a unified way means neither party suffers more than the other necessarily, right? They both take the same hit at the same time. That's what it takes to get hard things done. It's what it would take to balance the budget. It's what it would take to solve a pandemic crisis where you have to ask people to do hard things.
Mm-hmm.
It is a very challenging thing. And unfortunately, our political system doesn't reward statesman-like behavior like that. But the good news is there is a way through it, right? If we could get leaders to take that risk together, we can solve almost any crisis.
Mm-hmm.
So I'm optimistic in the sense that the answer is there. It's just it requires some acts of bravery to do it. I'm hoping that the students from your generation will learn that lesson and hopefully do a little bit better than our team did.